In this paper, we present the development of a telemanipulated microsurgery system for retinal surgery. This research was performed in Dr. Jay Cabot's lab at the University of Utah in collaboration with Dr. Paul Bernstein at the Moran Eye Center. Formation of epiretinal membranes on the retina can cause distortion of vision. To treat this condition, surgeons use instruments such as a microforceps and a diamond-dusted scraper to perform a series of peeling and scraping movements to remove the epiretinal membrane. It has been found that during retinal surgery, instrument forces are typically below 7 millinewtons, which is less than the human force sensing capability. Also, surgeons have to manipulate tissues with a thickness in the range of 0.5 to 61 microns, which makes the procedure extremely difficult. Additionally, the surgeons have to compensate for patient head movement. Complications in membrane peeling surgery can result in hemorrhage, retinal detachment, and regrowth of the epiretinal membrane. To assist in performing such procedures that require high precision, we have developed a compact 6 degree of freedom manipulator that uses piezoelectric stick slip actuators. The manipulator has submicron precision at the retina and can perform virtual RCM motions that are required in minimally invasive procedures. The manipulator is small and light enough that it can be mounted on a patient's head, reducing relative motion between the patient and the instrument. The manipulator is designed to use existing disposable instruments used in retinal surgery. It is telemanipulated by a Geomagic Touch haptic interface with a custom stylus that mimics the feel and behavior of a real forceps. Instrument adapters were designed such that existing disposable instruments in retinal surgery can be used in our system without any modifications. Two actuation mechanisms were developed using a stepper motor and a soft actuator that enable the use of actuated instruments like a microforceps and a microscissors. The instrument adapters enable quick change of instruments on the manipulator. We found the average instrument change time for our manipulator to be 13 seconds compared to 9 seconds required in manual surgery. To evaluate our system, we performed manual and telemanipulated membrane peeling experiments with a phantom eye setup that consists of a plastic retina attached to a ATI Nano 17 4-stop sensor. The retina and sclera are separated from each other such that only retina end effector interaction forces are measured. An artificial membrane made of paper is attached to the plastic retina using 10 microliters of genteel eye gel. To compare manual and robotic membrane peeling, experiments were performed by 4 subjects with different surgical experience. One subject did not have any surgical experience but was experienced with the robotic system. During experiments, the subjects had to completely peel the artificial membrane in our phantom eye setup with a microforceps. Each subject performed 6 trials for manual and robotic membrane peeling. To quantify performance in a trial, the maximum downward force on the retina, the maximum upward force on the retina, and the completion time for a trial were measured. Independent samples t-test was used to compare manual and robotic membrane peeling. Our results show that with limited training, robotic membrane peeling results in lower maximum upward forces for the expert, intermediate, and novice surgeons as compared to manual surgery. Robotic membrane peeling results in lower maximum downward forces for the graduate student as compared to manual surgery. Completion time is higher with robotic membrane peeling for the expert and the intermediate surgeons as compared to manual surgery. Thank you.